Let's bring in Pfizer CEO Albert Bourla. Mr. Bourla, welcome back. Good to have you with us.
Thank you very much for having me.
How's the business going? Now that COVID feels like it is less of a menace and your revenues in COVID vaccine products are down.
Yes, they were down. They were way ahead of what the analysts were expecting, but they were down. The non-COVID business grew 5%, which is a very strong growth. And as you said in your introductory comments, as we are moving in the post-COVID crisis era, we expect that COVID will not be anymore the epicenter of what we do. Still, the COVID products will remain two of the largest products that we have. But we are having many other products, and we are about to launch 19 new products in the next 18 months, 19 new products. So that's something that no one has ever done before, according to my knowledge. But we are up to the challenge to bring those products to those medicines to the patients that they need them.
You've grown your pipeline both by internal research and also by acquisition. I assume you're going to continue to do that. As the company maybe reorients away from the tight focus on COVID, what areas of the business will be the growth engine? Will it be vaccines? Will it be oncology? Will it be antivirals and anti-infectives?
Pfizer is a big plane, so you need multiple engines to fly. But to respond to your question, I think that our next moonshot is on cancer. As you know, we have invested $43 billion in a proposed acquisition of Seagen. Seagen has a technology which is called ADC. ADC, it is what mRNA it is for vaccines. ADC is for cancer. We think that we can take on cancer with this technology and accelerate even further the work that Seagen people have done, which was tremendous. But in our capabilities of manufacturing, clinical development, and commercialization, we can bring those products to patients that they really need them.
So the two areas in pharma more broadly, Albert, that people seem pretty excited about are Alzheimer's and weight loss. Are either of those areas where Pfizer is going to be, involved in a big way?
We are involved in a big way in weight loss. Right now, we have an oral program that of a category that's called GLP-1. We have two candidates that we are investigating. And by the end of the year, we'll select the winner and we'll move it very quickly to phase 3 studies. We are very excited about that profile. With Alzheimer's, we have outsourced a lot of our assets that we had. So we participate with 25% equity in a company that is working on Alzheimer's.
I'm also curious to go back to COVID for just a second. I thought I saw some commentary about your EU deal that would make you essentially the only provider of COVID vaccines in Europe going forward. Is that true?
We are negotiating with EU as we speak in very good faith, and we are discussing with all member states. So I don't want to make any comments because this is still ongoing. Once this is concluded, then we will disclose all the details.
Back to the weight loss drug, the idea of an oral medicine certainly has its advantages over an injection, which some of these other products, Lilly's products, among others, are. I'm going to ask you to go out on a limb here, and it may be too uncomfortable, but let's try. I'll hold your hand if you'll hold mine. How big a drug could this weight loss drug be, and what would the pricing look like if you've gotten that far?
We haven't decided what the price could be, but in general, based on the current pricing of the injectable product and the projected use, we think that this will be likely the largest category. So we expect that that could be as big as a category, not our product, as a category, close to $90 billion. And I think maybe 1/3 of that could be the orals. This is the area that we plan to play, and will be 2 or 3 entrants.
All right. Albert Bourla, great to see you, sir. Thank you again for stopping by CNBC.
Thank you very, very much for having me.
We're very grateful to you.